Can you see that?
Yep, can see that.
Great. Right, well, I promise to be quick, Andrew. My name's Tim Ringrose. I'm a hospital doctor from Oxford, and I'm here with my colleague Becca, representing our company, which is called Cognizant Group. And we're a relatively young company. We've been going just for a couple of years, and our focus is how to use technology to help the general population, which of course includes patients and people with lots of conditions, to understand more about their health and treatment. So you might be thinking, well, there's not much about VR here, but I promise you it's going to come up in a second. But I first of all wanted to just let you know about our Healthy Note platform, which is a platform that we've built to facilitate digital information prescriptions. We built this simply because once we started building content, we could see there was a need for a distribution mechanism. And when we surveyed patients and doctors and other clinicians, we found that people were still using paper to give health information, which seems very inappropriate and old-fashioned. And since COVID has struck, of course, the need for digital information has really become paramount. So I'm just going to show you a quick video which explains how Healthy Note works.
At Cognizant, our mission is to empower patients to better understand and manage their health. Integrated into the healthcare professional and patient relationship, the Healthy Note platform enables healthcare professionals to search our Healthy Note library to curate and send a personalized digital support package to their patients. Patients can easily access their recommended support package on a range of devices at their convenience. Healthy Note's patient information and support comes in many visual, clear, and engaging formats, including use of gamification and immersive technology for viewing of content in 3D formats such as virtual reality, and includes useful tools to track symptoms and create medication reminders. Initially personalized by the doctor, the support package can then be further personalized by the patient according to their needs through their usage and interactions data, or by searching to add new relevant modules. This helps patients to better understand how to manage their health, make informed decisions about their health and behavior, and manage all their health conditions in one convenient place. As a patient uses and interacts with Healthy Note, patient data can then be used to detect the need for early interventions and preventative care, connecting them back to the wider healthcare system. With Healthy Note, we deliver a better patient experience, empowering patients to understand and manage their health and ultimately improve health outcomes.
Great. So I thought what would be useful for today's session was to share some of our experiences of using immersive content distributed via our Healthy Note platform. Prior to COVID, we were putting Oculus Go headsets in GP surgeries and some hospitals. But what we found with COVID pandemic was that that was obviously not going to work any longer. And so we've done a lot of work to see how we could deliver immersive experiences and interactive visual experiences, sometimes in 2D, via other methods. So you can see that we've got some experience of delivering VR experiences using Oculus Go, but also using smartphones with Google Cardboard headsets. We've also been testing the use of smartphones with 2D content, making it as interactive as possible. And we've built that using Unity. And we've also got lots of experiences of using avatars in those scenes, whether they're 2D or 3D. So I thought it'd be useful just to run through some of the pros and cons of this approach. The pros are that what we found is that using visual content, particularly if it's in 3D with either VR or AR, is really engaging for patients and very memorable. And so when you compare that to someone looking at information, certainly a printed information on a piece of paper, people spend longer looking at it. They tend to explore more of the content, and they certainly remember more about it. And I'm sure some of that might simply be the novelty of looking at something in 3D, but research from other organizations really backs up that it seems to be something that imprints on our brain much more if we've actually seen it and interacted with it. And I think we've all experienced that in real life. And another useful benefit of VR experiences is that it seems to break down a lot of literacy barriers. So people who would find it difficult to understand something, either because of educational limitations or language limitations, can really understand something that would otherwise be very hard for them to get a grip from. What's been tough has been, of course, that immersive content is often very expensive to build. If you approach an agency, typical media agency looking to build a VR experience, you'll find that the budget often runs into 6 figures. So producing content that's very cost effective is a tough job, but it is possible using templates and using avatars and using low-end motion capture techniques can actually produce a really good result. But I think the biggest limitation that we've seen at the moment has been hardware. So as we've heard from Shafi and Andrew and others, buying HoloLens, which I think costs close to £5,000, is a valid thing to do and a good return on investment if you're training medical students or others. But we simply can't afford to adopt that kind of technology for patients. Even an Oculus Quest is about £300. Not many people have those yet in the population. And so hardware is a big limitation for disseminating these sorts of contents for patients. But as I mentioned, what we found is that it is possible to produce quite usable content using smartphones and using the Google Cardboard headset. So I thought I'd finish by giving you a couple of examples of how we've been working. Our HealthyNote platform's now being used in over 3,000 GP practices. And it's linked in with eConsult, a system for triaging patients and managing the clinical workflow. So the integration of HealthyNote with that system means that a GP can very quickly, either before, during, or after a consultation, search the HealthyNote library for some relevant information for the patient. Let's say it's about diabetes or hypertension. You can see some of the sources listed there. A lot of the content is not immersive, but there is a growing library of immersive content being added into that. And then the patient receives a link either by SMS or email, which they can click on and view the content either on their browser or on the smartphone. Clearly, if they want to look at the content in 3D, they need to be using their smartphone with a Google headset. Another route that the content is disseminated is if the patient's actually given a piece of paper with a QR code on, which I know sounds quite old-fashioned, but actually that works really well, particularly for specific content such as contraception, as you can see mentioned there. And QR codes, of course, great to do put on things like posters. An example in secondary care is one here that we're working with West Berkshire ICS, where for their patients with chronic kidney disease, which of course is growing in prevalence, they were looking for a way to provide information that was easier for patients to understand and facilitated better use of remote consultations for the clinic. So we've built a program.
That's all right.
Pardon?
Is the last 30 seconds, if that's okay. Sorry.
Yeah, sure. Just about to finish. So you can see the program provides information in a wide range of formats. If people want to look at something in print, they can have that, but you can see it's got a QR code on. They can look at it on their smartphone in 2D format, or using a Google Cardboard headset, they can look at it in VR. And if you look at the bottom left-hand corner, you can see we can not only do this in English, but we can also produce content in different languages, which of course is very important for many long-term conditions. The feedback from the pilot has been really positive, which I won't dwell on, but it's certainly high levels of feedback, both in terms of accessibility and ease of use. So I'll stop there, and I did have a final slide, but it seems to have gone. And look forward to hearing the other presentations, and welcome any approaches if anyone would like to hear more about what's happening with immersive content for patients. Thank you.
Thanks very much, Tim. That was great. And yes, please do follow up directly. If your contact details were supposed to be on the last slide, and if you're happy, please do share them in the chat, and people can
see that now, actually.
There we go. Great.
There's also some QR codes if people want to scan them, but I know we haven't got time for that to stay up very long now.
All right. Okay. Well, appreciate that, Tim. Thank you very much. If it's okay, we could move on to the next presentation. So we should have Dr. Chris Evans from Little Journey. Good to see you're waiting in the wings there, Chris.
Perfect.
And I can see that. That's great.
Brilliant. So my name's Dr. Chris Evans. I'm an anaesthetic trainee based down in London, currently doing a PhD. And I'm the founder and creator of Little Journey. We're being used all over the Yorkshire and Humber region in a number of hospitals, and also performing research in Leeds Teaching Hospital. Now, Little Journey is an end-to-end psychological preparation and support tool for children and family members who are undergoing a healthcare procedure. And this has all started for me based off my clinical practice and my research. And we're looking to use technology, research and data to improve healthcare outcomes. So when working in a district general hospital, I saw the sort of distress and anxiety of children coming for an operation, and I looked at what we were doing in order to prepare children for a procedure. And in the DGH I was working in at the time, we were giving out adult information leaflets, and I thought we could do better. A few years later, my son went for surgery, and I remember going to my appointment and getting given a whole load of information leaflets and putting them straight in the bin and never reading them. And that content was all for myself and none for my child. So what we wanted to do was make something that was engaging and interactive and could help prepare children. I actually got tricked into doing a PhD into children's anxiety before surgery. And from that research, we found that up to sort of 75% of children experience significant anxiety before a procedure. And this anxiety is associated with post-operative behavior changes, the need for physical restraint. And it's generally due to a limited understanding of what's going to happen in hospital, challenges in communication between the child and the parent, and being placed in sort of unfamiliar environments. And so over the years, we've grown Little Journey as the research has grown, adding more and more content. And what we've created is a smartphone application that can prepare children and parents for an operation in the comfort and safety of their own home. We provide age-tailored content, so for children 3 to 7, 8 to 12, and parents. And this is information they can use when comfortable, at rest, and either with the family or independently. Sort of the mainstay of what we're doing is actually a virtual tour of the exact rooms that children will go through on the day of their procedure. And they can interact with staff, they can learn about what's going to happen and how it might feel. And then we promote coping strategies to try and overcome that anxiety. One of the key things we've learned, though, is that parents are the gatekeepers of information, and actually we needed to engage them in the process in order to get that information cascaded down to the child. And this is something we've gradually improved upon over the years, and we drip feed information to parents both before and after surgery. Our virtual tours, we send VR cameras round to hospitals. They can take 360 images, and then we implant characters who they can trigger in both 2D or 3D mode. So a VR headset, a Google Cardboard VR headset, is an optional extra for that. And again, from the research, we found that older children like doing things in VR, younger children like doing it with mum and dad on an iPad in 2D, and parents like a bit of both. So what we're trying to do is keep the solution available to the masses and available to the most people in their own home. And we found that doing this through smartphone applications with a Google Cardboard headset was the best way for that. It does mean that there are some slight limitations on what we can do in those environments, but it's something we're continually building and improving upon. So to date, we've had fantastic feedback and reviews from patients, healthcare professionals, and the governing bodies, and a 4.7 App Store review from 360 reviews. But actually, more than ever, Little Journey is relevant now because of coronavirus. It means that we're not doing face-to-face pre-assessment clinics interactions. Everything, again, is tailored over the telephone to parents, and there's an increased fear of hospitals and exposure to coronavirus. So really, we're more needed now than ever. We have done case studies. So this was at South Tees Hospital. We were introduced over a couple of months, and of the 896 patients having surgery, we were able to 71% of the patients who were given access to the application downloaded and used it. And it led to a 30% reduction in recovery time in hospital, a 1 to 2 hour reduction in fasting times for both fluids and solids, and a reduction in on-the-day cancellation by providing tailored information as and when it's needed. And we did a health economic analysis on this, and we found that we provided a £3.50 benefit for every £1 invested in Little Journey, and a £6 societal benefit for every £1 put in. We've also looked at high-risk groups, so children with ADHD and autism, and found that we ended up having a 30% reduction in anxiety levels of children through use of Little Journey, and this was a quality improvement project performed at Belfast. So really, we've got a lot of changes upcoming now. We're providing hospitals with real-time control of the information and able to edit checklists, contact information, storylines, articles for parents, so they can control the information that's provided to families. We're capturing data for patient-reported outcomes and giving this back to hospitals for quality improvement. And we're expanding from general surgery to coronavirus swab testing, vaccinations, phlebotomy, endoscopy, and also looking into the adult market as well. So at the moment, we're a very low-cost solution. We're costing £240 a year per hospital, and that's for as many pathways that you have for your general surgery patients. So please, feel free to contact. Here's my email address. The app's available to download on the app stores for free. And please just get in contact if you need anything else. Thank you.
Cheers, Chris. Much appreciated. That was really good, really interesting. Thank you. And within time, so very much appreciated. I'll roll on to the next speaker, if that's okay. We should have Dr. Samir Shah from Dorothy. Are you there? I can see your slides.
I'm here. I had a minor issue with my iPad, so I'm back onto my slightly ancient Mac. So I'm Dr. Samir Shah. I'm a consultant neuropsychiatrist. Can you see my slides?
Yeah. See that.
Okay, perfect. So I'm a consultant neuropsychiatrist. My sort of day job is looking after North East London's dementia patients, and I chair that across North East London and have a sort of practice in Waltham Forest. I'm also one of the NHS England clinical entrepreneurs, and we started Dorothy with my friend Ilya, who you can see here, mostly because of his grandfather. Now, his grandfather, he moved in with him, he had a dementia, but like half of all people who have a dementia, he had communication problems, and he was in this new environment. He was confused, he needed constant care, and so I pretty much accidentally helped him make a interface for his grandfather. So we mapped the room, we showed him where the bathroom was, where the bedroom was, where the kitchen was, and he was able to use this interface on his phone, and it went all the way back to an iPhone 6S. So we thought, well, actually, this is about 2 years ago, and so just pre-COVID, and we thought, actually, there's quite a lot of people who would benefit from something like this. And so what we wanted to think about was, okay, how can we roll something out that would actually be useful, that would actually be mobile, so people, as they get older, as they need more things, the places where they have interactions are more and less familiar. So it might be a care home, it might be a parent's house, it might be A&E. And what we thought was, okay, let's first target the 10% of dementia sufferers. That's about 1 million people between Europe and the USA who use walkers. And let's use their existing walker along with your old iPad, because we can go back to an iPhone 6S. So what we wanted to do was use stuff people already had. And the research so far is that if you have a wearable like this Apple Watch I'm wearing, people with dementia just take them off. They're essentially useless. And the problem with other monitoring solutions is that they're essentially smart homes. So you have to install them, and they're not very mobile. And what we wanted to do was show that we can do this. And we recently won a big award internationally called Wish 2020, which is the World Innovation Summit in Healthcare Award as one of the as a Spark competition. Also, looking after somebody is really, really difficult. So half of all carers have depression. That has its own impacts on society, on those kinds of costs. And we can see that dementia is already a $1 trillion worldwide care cost. It's going to double in 10 years and treble in 20 years. And sort of 10% of that whole cost is on people that are disorientated. So what we wanted to do was to use this tablet to initially orientate people in nursing homes. And what we've made is something that can remind people about daily activities. It guides people around using augmented reality and tracks people inside their house using sort of computer vision, basically. And that then gives real-time monitoring. So real-time biosensor monitoring to caregivers. So let's say your dad is in A&E, you know that they've walked X amount, you know they've been here, you know they've been here. Now, we've been testing this. We're much younger and much less mature than a lot of these really amazing companies and things that we've been finding out about today. And thank you for putting this on. But we've just prior to COVID, we tested it for around 6 months, and we were initially just hoping to get a proof of concept out, an early prototype, and to see whether it would help people. And even in that really, really basic iteration, people started to move more. And for the first time, people that used it were able to find their bedrooms. So these are the comments that we were getting. So it's really something that has helped people already. And so it's a really simple interface. This is a very simple thing. And those that know a little bit about dementia know that when the back of the brain gets affected, the vision also gets quite affected. So everything that you do for the person with the dementia has to have really simple icons. And at the end, I'll show you a little video of the kind of interface that they have. But then you get a real-time manifestation of where they've been, what they've been doing. We can scan floors in about 20 minutes. So a house in about 20 minutes, a floor, perhaps an hour would take. A little bit of economic data. So annual cost is about 31,000. And if we even save 5% on costs, we'll save about 1.25 billion. So this is the person who starts to find his room. So this is David. He's actually somebody I diagnosed with the dementia about 2 years prior to this. And he'd moved floors. He hadn't really been able to find his way around. He always needed assistance to get around. And this is him using it. And he most of the time didn't use it. It was there, but it was always taking data, saying how much he'd moved, where he'd moved. And because, again, he was somebody who couldn't really talk that well or didn't really communicate that well. He only really communicated with a family member. At that time, they were working in Italy. And so they were able to call in. You can see that we've had it to work within clinical environments, and that the interface is very simple, big icons, very difficult to very difficult to make a mistake with. And even if they don't press it, they can point to it, which is actually what David did. And within about 4 weeks of using it for a day a week, he was able to find his room. So in the top right, you can see the map that we made using an old tablet that was 2 years old. And so immediately we've got benefits. So we can say we can bring together all these sensors that you have. So an iPad has accelerometers, it has microphones, and you can learn the sounds of things that are happening. So let's say you're in the bathroom, you can learn that they're brushing their teeth, for example. You can learn that they're sleeping. You can learn that they've eaten that day. So that gives you some level of knowledge of what's happening with somebody who forgets a lot. And then, in the future, you can use these large data sets. And let's say they're going to the bathroom a lot more. Does that mean anything? Let's say they're sleeping a lot more, not sleeping at all. That could tell you something about what they are like as, physically. So it might mean that you have to go and see them. And the whole idea is to stop things before they happen. We're not quite there yet, but you can see how that can be really a very easy kind of iteration. So we were really lucky that my patch in Waltham Forest, the council allowed us to test it in their care homes, and I work at North East London. We're also working with the UK government, and we won this innovation award for International Innovation Award, and we're working with SITE, who are in Portsmouth and affiliated with the AHSNs. What I want to do is really quickly, there's my contact details. Really quickly.
Can I just interrupt? Sorry, Samir. We do have 2 more presentations just to get through before 20. So apologies, I don't think there'll be time for the video.
Okay.
Is there a YouTube link that you could drop in the chat?
It's about 30 seconds. It's about 20 seconds, if that's it's not long.
I think we'll just try and stick to time. I'm really sorry.
Okay, that's fine.
If you do drop it in the chat, people will be able to follow up and watch that. But,
no problem.
Yeah, we just want to give everyone an equal chance, But thank you very much. That was really interesting and really promising innovation there. If I could move on to the next speaker, if that's okay. We should have Craig Chater from IMI. Craig, are you there?
Yep, I'm here.
Excellent. Do you have some slides to share?
I do. Just give me 1 second.
No problem. Are you okay to stop sharing your screen, Samir? There we go. Excellent. That's great. Okay, fire away, Craig.
Are we all good, Joe?
Yep, all good. You can see that. Great.
Hello, everybody. My name's Craig. I am the founder of IMI, and IMI has a meaning of Imagine Making Memories Everywhere. What we do here, we're bringing the wonders of our world to the eyes of the children to give them a nice, long life memory. What we offer an interactive, immersive virtual reality experience by combining books and technology together. Using the sensory therapy and engagement, we found ways to help children receive medical procedures in hospitals and other health sectors in many different ways. It was all designed around my daughter, which is called Imogen. This is actually me and Imogen on our first day creating IMI. And that was the reason why I called it IMI, so I could name it after my daughter. So she has a massive impact around this product that we've created. I am very proud to show you what I've created today. What we have created is an easy new system to help accessibility and to help others by using only smartphone device in unique ways by using virtual reality. We have some amazing people that are on board working with us as well. I do have a video that's about 4 minutes long, which basically was created by the BBC. This tells mine and Imogen's story from when it was created from the right beginning. Do you have to go? Yeah. Hey kids, mum's after work. Bye. I got a wife, Jennifer. I've got 3 children.
See you later, guys.
Imogen is my second.
Where's Mummy going?
Let's go to work, baby. My eldest is Harley. And Kirby, our latest one, is my third. Come on then. Let's put your jelly shoes on.
And you'll make
then we can go, yeah. We went to the shopping mall in Hull and we saw that they were selling like a VR headset that you put your phone into. That's it, too. I went home and then Imogen picked up and she was like, I want to go. And when she put it on, she got really, really upset and she starts crying. That's when I realised that what she was watching wasn't really suitable for a child like Imogen. And that's why I took it on myself to create videos that was suitable for Imogen. Come over here, look. Have a look at the flowers while I get the camera ready. Stay where I can see you. When you see Imogen, you see her as a normal child. There's like no physical disabilities there, so people don't see her as a disability child, they just see her as a very friendly child. But Imogen was actually diagnosed with Williams syndrome. It's a rare genetic condition. Even though she's 8 going on 9, the mindset's like a few years back to what her actual age is. You tell me where I should put the camera. Should I put the camera right there? No, there. Back then, when I started it was just a simple sensory world where it was just different colours and sounds. So then I took it a step further, and that's when I made it into a VR book. Oh, here we go, look. Each page is a different lesson. Some maths? Yeah. You want to do some maths? Oh, look, we've got some new ones, look. Imogen gets distracted very easily when she's learning new things. Yeah. So this one is blue. Blue. I'm taking that distraction away because there's nothing happening around her. Can you say it? Blue. Because it's only Imogen and the VR. Yellow. Good girl. It helps her with her memory capability, like learning words. I found it. You found a bird? Yeah. And her numbers as well, her maths has gone amazingly good just lately. Big clap. Oh, big clap. Yay! I create different worlds, I create different lessons that she can educate herself from. The money side to the project is an issue. The money rocks. I know I need investment to make this product work and get it out there in the world. But getting investment has proven to be very, very difficult. The main part of the problem is everyone saw me as different. What's like your bachelor's degree, what PhD have you got, etc, etc. And when I turned around and said to him, I'm a simple guy with just a chef's job who's literally taught myself all of this, I don't think they was too impressed. But it doesn't stop me teaching myself new things or trying to create a new adventure or trying to create something different towards the project, add into it to make it better. What I would say to someone else trying to create an invention to make something better in the world is never ever give up on it, because anybody can do anything if you put your mind to it.
So that was actually made 3 years ago. And since then, we've got over 5 million views worldwide just from that one video. When we started making Imi, it was all purely around my daughter as a hobby to help her in her education. But we actually started to see the health benefits that it was starting to give Imogen, from mobility to sensory needs, to anything that was possible for Imogen, she was doing it that wasn't possible. So we've adapted it to make it into a sensory therapy book, so all of the children within the hospitals can use it as well. We've got some other great media coverage from it as well. This is our research group that we did for extensive R&D. This is actually Imogen's school and class. All have complex disability needs and all showed very great, passionate signs of improvement from using the sensory therapy that was providing for them. We've also acknowledged well from our R&D research that trust and safety, loud noises, are all the key points on what children are affected by when visiting hospitals. So we've incorporated that with our product. On the bottom left, we have a young lad who is blind, partially blind, shall I say. We actually bumped into him at the Bonus Arena Tech Expo. We told him what we was doing and he said he doesn't think he'd be able to see anything. But instantly, he was starting to see things straight away, things that he's never seen before. And he was actually stood there for a long time and wanted to use it more and more. It's actually one of the best days of my life.
Okay.
From there as well. Oh, sorry.
All right.
Last 30 seconds.
Yeah, so that's okay, thanks.
All right. Well, we'll just go to this one then. If anyone finds out any more about what I'm doing, all my contact details are there. It'll be great to meet a lot of new people that want to learn more about IMI. And thank you very much.
Thanks a lot, Craig. Yeah, cheers. And sorry to cut you off. It's just we do have one final presentation before we head back into the main room. So we should have Sarah Kelly-Toran from Bristol Biomedical Research Centre. And I can see your slides are up already.
Can you hear the slide? Can you see the slides?
Yes, I can see those. Yeah.
Brilliant.
Yep.
So, good afternoon. My name is Sarah Sokali-Toran, and as mentioned, I work at the Biomedical Research Centre in Bristol, and I'm here primarily to talk about kind of a new line of research we're developing, and we're at the very early stages, that looks towards making the most of advances in VR technology in the fitness and food industry to improve type 2 diabetes self-management support, and particularly focusing on facilitating behavior change. To start from an example, we're looking at physical activity. In 2012, the physical activity care pathway was commissioned to encourage adults to become more active. And that initiative was led to kind of generation of different more community-wide initiatives, such as the exercise referral schemes. However, physical activity remains a problem, particularly among people who have chronic medical conditions or physical disabilities. We see especially low adherence to home exercising and low retention rates in the existing initiatives. And overall, inactivity is costing about 4.7 billion per year. So the reason why we still see the inactivity, the high inactivity levels, is not entirely clear, and most likely it's due to a mixture of barriers that are experienced by individuals. And some of these include limitations due to the complexity of certain health conditions, especially when we look at comorbidity between medical conditions and physical disabilities. Individual barriers such as the perceived uncomfortableness experienced when first engaging in exercise, differences between people in the motives, so what gets us to exercise, and kind of the modalities, preferences in terms of the modalities we like to engage in exercise, whether we like to do it outdoors or with others or alone. And finally, obviously, it's the cost of engaging in different types of exercise and inequalities in public availability of infrastructure to support physical activity. So ideally, what we would like is a personalized physical activity support that fits both the health condition and the motives of every individual. So a bit like a personal trainer, but this is not efficient. It's too expensive for the NHS. And that's when we started thinking about looking at VR-led physical activity programs. Virtual reality can enhance the exercise experience beyond what is achievable through Wii or Zoom. For example, the individual is completely immersed in a digitally generated VR environment within which they exercise. One experience that I kind of have to always report is that of a participant who was flying a horse while cycling on a static bike. And in this experience, if you stop cycling, the horse drops onto the ground, and the participant shouted out, "I can feel the gravity force." So that kind of experience is not achievable with other digital platforms. Another way in which exercise can be enhanced is by incorporating the gaming features that VR has that other activities such as Zumba or park runs do not have as strongly incorporated within the exercise. With VR, we can also generate personalization. What we're looking at towards is bringing together different exercise activities developed by industry and researchers, so that we can then incorporate machine learning and AI, so that the platform, a VR platform, can adapt to a patient's fitness and mobility, as well as individual preferences in exercise modality. And therefore, that phase of change between I want to be active and actually being active is facilitated, it's more gradual. And finally, obviously, as you will have heard, VR, an exercise program run from VR relies heavily on the use of headsets, and there are different varieties of headsets available. And therefore, we can start looking towards implementing the headsets in different settings and community settings, such as, for example, repurposing community spaces, sports centers, in schools, or even in the household. And by doing so, we are reducing the reliance on an NHS infrastructure. And if the program is designed by consultation with clinicians, dietitians, we can therefore start relying less on specialist resources to provide support for diabetes self-management. And finally, also VR has a really useful capacity to collect very rich behavioral data, and that can be used for monitoring purposes. What we envision a VR-based physical activity program to be particularly useful is especially in these transitions between wanting to become active and starting to actually engage in exercise, and as well as ensure and supporting adherence to an exercise program. And therefore, we don't want to replace existing exercise initiatives, but rather making them more successful. We have done some preliminary research where we asked sedentary adults to engage in 30 minutes of exercise on a static bike before with virtual reality. So here are some of the games they could play, and then without virtual reality. And after the exercise sessions, we also gave participants access to a buffet meal. And you can see here the results. So we made sure that the exercise session was the same in terms of we did not find differences in mean heart rate, nor exercise duration, nor energy expenditure, but we did see a difference in how exercise was experienced. The green line represents exercise with VR, and you can see that participants reported the experience as more energetic, more pleasant. On top of that, we found that when exercising with VR, participants ate 12% less. It was about 100 calorie difference, which seems like a little, but for weight loss programs, that is quite an interesting finding, and we are doing more research into that at the moment. But this is just an example of where physical activity, how physical activity can be supported with virtual reality for diabetes self-management. But we can also look at using similar approaches to enhance and promote healthier dietary behaviors and diabetes education. So, for example, one of our participants, he's part of our patient and public involvement group, directly indicated that he would actually requested that he wanted an avatar dietitian to go with him in a virtual supermarket and help him make better dietary decisions. As part of a GW4 collaborative, which involves several universities in the Southwest, we are looking at what do the general public think of VR and other novel technologies for healthcare. And what we saw is that although 22% know that VR is being used in healthcare, up to 76 would consider VR for their diabetes management if they were to develop type 2 diabetes.
Just the last 30 seconds.
Perfect. And we also, as part of that project, we also asked healthcare professionals what they thought were the main barriers to novel technologies in healthcare. And it is quite important, as has been mentioned earlier on today, to consider kind of how the technology will be eventually implemented in the healthcare system in terms of the organizational culture and who is responsible if something goes wrong. And so to address that, we've started some kind of work in terms of developing cross-sector consortium to promote health-related behavior change, to facilitate this implementation of VR technology in healthcare, especially when we look at community settings. And finally, we are working with several companies to develop an event that would increase public awareness of VR applications and seeing what the feedback is in terms of uptake and the challenges they would face. That's it. Thank you.